Today we will discuss on various types of coronavirus and recently identified novel 2019 coronavirus. Novel coronavirus that was first reported from Wuhan, China on 31 December 2019. As on 9 February, infected cases are registered as 37,612. Number of deaths are registered as 815. And the recovery cases are 2,990. Hence we can easily find the mortality rate as on 9 February. If we get the percentage of deaths over infected people, we can easily identify the mortality rate, that is 2.17%. That means 3 infected people are die for 2019 novel coronavirus out of 100 infected people. This is how coronavirus looks like. The term coro comes from crown-like structure around it. Coronaviruses are the family of viruses where common cold, Middle East respiratory syndrome, severe acute respiratory syndrome and novel 2019 coronavirus are in this family. The term novel comes from word new, as it is a new coronavirus. Transmission of novel 2019 coronavirus, which is same for all types of viruses in this family. The source of these viruses are animal. The novel 2019 coronavirus spreads from person to person in close proximity, similar to other respiratory illnesses, such as the flu. Droplets of bodily fluids from an infected person are dispersed in the air or on surfaces by coughing or sneezing. These droplets can come into direct contact with other people or can infect those who pick them up by touching infected surfaces and then their face. Like severe acute respiratory syndrome was transmitted from civet cats to humans. It was first identified in China in 2008. Middle East respiratory syndrome was transmitted from dromedary camels to humans. It was first identified in Saudi Arabia in 2012. The animal source of the 2019 novel coronavirus has not yet been identified. It's likely that an animal source from a live animal market in China was responsible for some of the first reported human infections. Common signs of infection include cough, runny nose, headache, respiratory symptoms, fever, shortness of breath. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. Incubation period of 2019 novel coronavirus could be up to 14 days. Now, main question is it dangerous? It can be explained by the mortality rate. We have already seen that mortality rate for new 2019 coronavirus is 2.17%. Which is much lower than that of severe acute respiratory syndrome, Middle East respiratory syndrome and Ebola. Viruses that spread quickly usually come with lower mortality rates, and vice versa. The novel coronavirus mortality rate stands at 2.17%, whereas severe acute respiratory syndrome killed 9.9%, Middle East respiratory syndrome killed 33.96%, Ebola killed 39.99%. Those with low immunity such as the old or sick persons are most at risk of becoming severely ill or dying from the coronavirus. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing, and avoid direct contact with live animals in affected areas. Share this video as much as possible and make people aware of this new strain of virus. Thanks for watching.